यस प्लीज स्टार्ट कर दें।
Hello, Assalamu alaikum. My name is Dr. Shaida. I am a public health specialist with MBBS. Now, currently, I am working as a technical advisor of a tech challenging table. Today's topic is infertility. Infertility, why it is important to address this issue? Because it is a public health issue also. It affects 26% of our population nearly. And public health issue हम इसको इसलिए कहते हैं because we call is because it causes an economical, social, psychosocial, and in our culture it is considered as a taboo. And on the policy level, as 17.6% of adults are suffering from this. In Pakistan, 22% population. But unfortunately, the extent at which it should be supported by policymakers, by government, it is not. And it is usually it impacts generalized groups, marginalized population, because they don't have access to the fertility care diagnosis, whether treatment or whether uh, other facilities. And it uh, point out that we are in gender equalities, especially for women. Though unfortunately, females are being blamed more and they are suffering from, and it affects not only the social but also the marital life of a woman, because many male don't understand that it is a male issue also. So they blame, and the marital life, it ends unfortunately in the separation and otherwise. Why economic burden we call it? Because it is the starting from diagnosis up to treatment, it is very much expensive. At the public level, government level, it is not given any priority. So funding is very much restricted. Therefore, if anyone who is suffering, if they are poor, they cannot have any access to this treatment. And it is not a condition. How we will define the fertility? It is not a condition. It is a disease characterized by inability to conceive after 12 months below the age of 30 and 35 years of women. Regular unprotected intercourse means the couple is not using any of the this contraception method. As it 17.5%, 1 in 6, every 6% is affected, and 22% of adult population. In Pakistan, we show there is inflation of this population, but every 1% in 5 couples are affected. 18% secondary for infertility, 4% is primary infertility, which we are now going to describe. What are the types of infertility? Primary, secondary. Primary means no pregnancy ever achieved. Secondary, at least one pregnancy, past pregnancy, but now the couple is unable to conceive. It is called secondary. In Pakistan, 18% is secondary, 4% of all infertilities are primary infertilities. Why we only blame the women? It is equally distributed. 33% problem is in women, 33% men suffer from this problem. While 33% equally suffer both partners, means it is equal disease among men and women. Why? Now we will discuss about the major male infertility. What is the major causes of male infertility? For a man to be fertile, he needs a healthy reproductive system with quality and quantity adequate for sperms. Means the causes are distributed. Number one, in the sperm disorders. In sperm disorders, 90% are in sperm disorders. From them, azoospermia means male is uh, no sperm is detected in the semen of a male. It is 10 to 15% of all the causes of azoospermia. Means 1 in 10 male are suffering from azoospermia. Oligospermia, low sperm count. We need 25,000 ml per million, 25,000 million per ml sperm. But it is of very low count. So it is azoospermia. If it is azoospermia, then it is for the sperm to fertilize, it must be mobile. Mean there are sperms, but their mobility is restricted. They are unable to move through the cervix, vagina to reach the fallopian tube. Then there are abnormal shapes. If their shape is not abnormal, because sperm moves from their head upwards from the vagina to cervix. So if they are not, I mean, their shape morphology is not, then there is no use. There are sperms. Unfortunately, all sperms are dead. No sperm is alive. Combination of all these conditions. Then there are some genetic problems, yeah, chromosomal. One of the main is cystic fibrosis. It is a genetically transmitted disease, Klinefelter syndrome, in which there is no Y chromosomes and Y chromosomal microdeletion. It is also genetic. Third is structural problems. We need a healthy reproductive system for male. The first 90% for is called varicocele. What is it? These are enlarged veins covering these testicles. It leads to reduced sperm quality and quantity, and all the 40% infertility causes are due to the varicocele. It is reversible. Blockage of the whole system, starting from epididymis up to the vas deferens, to the penis, there is different uh, dif blockage. How they occur? They occur due to, most commonly, sexually transmitted infections and diseases, mumps in the puberty, surgery, anyone, any male who have got surgery, and they can have this blockage. Birth defects, by birth, there is obstruction, or undescended testes. We know when a male child is born, the first thing is that the pediatrician or gynecologist, it checks that whether the testes are in the scrotum or not. It is also treatable cause. Then we come to the hormonal issues, because for the sperms, for sexual activity of a male, we need enough hormones. So if they are not enough or they are not sufficient quantity, the important is testosterone. Then, because testosterone, this hypothalamus pituitary, it is a vicious circle. Then there is a pituitary, a thyroid disorder. It also affects. Then everything is there, but the male is unable to perform his sexual activity properly. Means he has got some erectile dysfunction or premature ejaculation. Either due to some disease, he has low sexual drive. Retrograde ejaculation, what is it? Because instead of uh, ejaculation through the penis to reach the vagina, it gives retrograde and reach to the urinary bladder. Then risk factors, mumps after puberty, as I told before that, testicular injury or torsion, anyone have got the testicular injury, or sometimes we see that there is torsion in the testes, it is a medical emergency. Undescended testicles, though they are reversible, but sometimes they can be damaged. One thing, exposure to high heat means laptops and hot tubs. Usually when we take the history from the for the infertility, we always ask about the occupation of the male. Why? Because Those who are exposed to these uh, truck drivers and all these high heat, it disrupts the uh, testicles, and sperm quality and quantity is not to the optimum point. Some medications is for depression, blood pressure, ulcers, some autoimmune disorders. Other are environmental factors, which are lifestyles. Most important is radiation industrial chemicals, because industrial chemicals are radiation who work in these radiology department. If there is from count and quality can be compromised. Drugs, cocaine, marijuana, steroids. Most important is alcohol and smoking. We see obesity. Obesity, how the obesity affects the this infertility? It disrupts the hormones. When the hormones are disrupted, then there will be no this quality and quantity plus this uh, sexual function, it will be disrupted. Prolonged testicular heat exposure. How it is diagnosed? First diagnosis is in laboratory, semen analysis. Semen analysis, we see the quantity, quality, morphology, everything is analyzed, pH of semen analysis, that how much sperms are active, morphologically set. Then we go for the hormone blood test. Anyone who has got thyroid disorders, who have got pituitary problems, who have got hormonal this diabetes mellitus, then we, after examination, we should so ultrasound scans for inguinal regions plus scrotal region for varicocele or any other pathology there. Finally, we take the testicular biopsy. It helps diagnose the genetic disorders, especially the cystic fibrosis. Some cases are modified, it can be prevented, some cannot be. It depends upon the cause that how much the infertility can be prevented. But one thing I must tell that it cannot be predicted before one person goes into the sexual relationship. It cannot be predicted that this will be infertile or not fertile. Not it can be wholly prevented. That is why that everyone don't know that whether I am fertile or not until unless he starts his sexual activity. Some are preventable, like structure, uh, which smoking, alcohol, weight gain, stress. It also disrupts your hormones. And one thing, overheating of testicles. Some professionally people who sit for longer times on tracks and drive heavy vehicles. Toxins are pesticides which are in our environment. Some is drugs which are taken. And lifestyle choices matters. But the congenital, structural, genetic, they cannot be prevented at all. Now we come to the female infertility. Infertility, it is couples of millions of couples worldwide. Why it is important to introduce the infertility? Because the females are always blamed. So we have, for this reason also, the females are more come to us more than the males, because sometimes it happens that male go to the laboratory. If they are told about their semen analysis, they go, they take their semen analysis, and when they found that there is any disruption or any problem, they don't bring to us because they don't want to blame them. So always the females are the most who come mostly to us, though 33% male and 33% female. But usually female comes first, then we send the males for the diagnosis and treatment. So let's come for the female infertility. As in the males, similar, because for fertility, we need healthy enough quality quantity of sperm. Similarly, in females, we need ovum. They should be healthy and properly. They should rupture every month. Every month, on the 14th day of menstrual cycle, one egg is matured and it is released from the ovaries, and then it is picked up through fallopian tubes by and implant fertilization takes place in fallopian tubes. Then the this fertilized blastocyst, it is comes with the celiac, or it's there are fine cilia who move and bring this fertilized ovum up to the uterus. Means the whole process should be intact. So the every ovulation is must. If female is unable to ovulate, eggs are not either they are not produced. If produced, they are not ruptured or not picked up from the by the this fallopian tubes. So the 90% cases are due to unavailability of mature eggs. Why this is? It comes polycystic ovarian syndrome, which is very common nowadays. And other is primary ovarian insufficiency. What is it? It comes before 40 years age. The ovaries stop to produce FSH, LH, which are necessary to produce the ovaries, ovulation. So they become unable. But that is why the age is also important factors. Then we will come to the after ovaries, from where the egg is released under the FSH helps to mature. LH, luteinizing hormone, helps to rupture the mature. Then that mature egg is picked up by the fallopian tubes. The fimbriae of fallopian tube, it picks up and proms. When there is problem in the fallopian tubes, naturally there will be no, either there will be no this pickup and all these things. So the fallopian tubes must be open functional. Any blockage or damage to fallopian tubes will produce infertility. What causes this? Similar untreated sexually transmitted diseases, STDs, unsafe abortions, which are very much common to us because we usually go for unsafe abortions. It produces the infections which travels from the lower up to uterus and then up to the fallopian tubes, that causes scarring of this postpartum infection. Similarly, after delivery, if it is not with precautions which we need for a healthy delivery, then infections, because after delivery, the whole reproductive system is open from starting from vagina up to uterus. And if it is aseptic measures are not taken, the infections will travel from retrograde and inform this blockage of this pelvic and abdominal surgeries for anything we patient or female goes. It intentionally or unintentionally sometimes damages the this fallopian tubes, especially this appendicitis. Mostly it affects this because they are very close to each other. Other important, second most common and female disorder related to this reproductive system is endometriosis. What is endometriosis? Endometriosis, the endometrial lining, which is inside the uterus by some problems, it is implanted outside the uterus. Most commonly, it is in the ovaries and it causes scarring, and in fallopian tubes, it causes scarring and blockage of. This is the endometriosis is the second most common cause of the female menstrual problems. Then we have some structural abnormalities, as we saw in the male reproductive system. For female to be reproductive or fertile. Healthy reproductive systems should be there. But if there are problems in starting from vagina, uterus, fallopian tube, up to ovaries, then there must be some problem. The uterus must be structurally sound for implementation, include either congenital or acquired. Congenital, absent uterus, or rudimentary uterus. Sometimes uterus is developed, but it is of infantile, just rudimentary. Either its shape is not appropriate, like bicornate, accepted. Acquired, which are acquired, mostly fibroids. It is the first cause of this menstrual disorders. Then endometrial polyps. These are benign things. Third is endometriosis. As it affects in the fallopian tubes, it affects the ovaries also, it affects the fallopian tube, it affects also the uterus. Then scarring. Scarring, when there is unsafe dilatation and curettage, which is very much popular in our rural areas, because for everything they do the DNC. It should be aseptic. Sometimes they don't use aseptic measures. So after any post-surgery DNC, the scarring occurs and the endometrial lining is totally gone. And naturally it becomes infertile. Sometimes there are factors in the cervix, because for cervix works as a passage from where the sperm travels up to from vagina, from cervix to the fallopian tube. And cervical mucus helps the penetration and facilitate the sperm to move to up to the tubes. If there are problem in cervical mucus, normally if it is very much thin during ovulation and all these things, but if it becomes thick, it obstructs the movement of the sperms to reach up to this. It causes are different, sometimes cervicitis, STDs, and various. But if it occurs, it becomes hostile. pH is not so much that it should facilitate then cervical and cervical stenosis. It may be congenital, or sometimes after some surgery, it becomes stenosis. It is stenosis, so the sperms cannot move, and there is scarring of the cervical cave. Vaginal abnormalities may be congenitally. Sometimes some women have a small vagina or septate vagina. Sometimes acquired, as which we call vaginismus. The female, in female mostly, it occurs because they are unable to allow uh, this sexual intercourse. So they feel the discomfort during this intercourse. Then we will come similarly as hormonal or endocrine disorders. For ovulation, we need balanced hormonal hormone, which help to from hypothalamus up to ovaries. Hypothalamus releases, stimulates pituitary gland to release the gonadotrophins. Gonadotrophins comes down. It stimulates the FSH, LH, and estrogen, progesterone. They are all should be balanced. Like in PCOS and in ovarian, primary ovarian insufficiency, if there is problem, then it starts from the upper, from our brain, hypothalamus. Then it comes pituitary gland. As tumors are hypopituitarism. Other gland is in pituitary, this prolactin is released, but it is basically for the breast milk excretion. Sometimes what happens that it is disrupted, it is increased without feeding mother. Mother is not feeding, but a small benign tumor in pituitary, then it a vicious circle starts, and the estrogen, progesterone, if FSH, LH, there are not in balance. Insulin production from pancreas increased as it causes disruption estrogen, progesterone, and also it leads to the uh, in PCOS. It is a cause of PCOS, means eggs are not released. Then risk factors, as I told you, fertility naturally declines after the mid-30s. That is why the definition, which we can say, if it is after 35, we consider a female fertile or infertile if it is age depends. In normal, it is for 12 months of regular course. But if the age of female is more than 30s, 35, then we before labeling that this is we consider the period of sexual history 6 months, because this ovulation and the quality, quantity of this all is disrupted with the age of the female. Health conditions similar, endometriosis affects all these conditions because it can be in the ovaries where it makes chocolate cyst. These are not in endometriosis as ovaries. It disrupts the hormone production. If it is this ovarian is this fallopian tube blockage. If it is in outside anywhere in the pelvic condition, it causes adhesion, so it is everywhere. Chronic illnesses, diabetes, lupus, it is asthma. It also because medicines and eating disorders. Sometimes we have seen that female for reducing this weight, their eating disorders and their stress, anorexia, bulimia, both affect directly the hormonal conditions. Obesity, very much fat, very much estrogen, progesterone disruption, or being underweight. Similarly, it affects the ovulation. And we see the golden ovary syndrome. When start exposure to toxins, we uh, discussed later, earlier. Smoking also in female, 13 to 15% cases. Alcohol use, no doubt in Pakistan, is not that an extent, but however, toxins are workplace hazards. Similarly, if it is the female is exposed to the radiations or some toxins, pesticides, then it affects this uh, ovulation and hormones. 25% are infertile couples contributing complex factors. Then, how to diagnose the female infertility? Female is infertility as compared to male infertility is easy because males usually do not cooperate, do not give this history. Main is the medical, sexual plus menstrual history is most important because this we want to see that whether it's egg production, it starts from production of egg, then it should take proper fertilization, then implantation, then it grows. So menstrual history is also important. Medical history, if chronic illness, sexual history. Sometimes the patients come to us, they say that they claim of infertility. Even when we take the sexual history, they are not living with their husbands. What the infertility we label regular, unprotected sexual in history for 12 months and above 35 age female 6 years. But it is more important whether husband and wife are living together or not, because ovulation takes one on the 14th day before the next cycle, once in a month. So it is more important to history, ask the history. Then comes the examination, basic test, pelvic examination, whether there is problem in vagina, septate vagina or something, or there is a painful any infection, or then we come to the laboratory testing, FSH, LH. More important is on the second day for the ovulation. It is AMH. It is for whether anti-Mullerian hormone, whether it is ovulation is taking place or not. It is most important. And it is performed on the second day. And other depend upon the thyroid. We go for thyroid. Or if AMH is not proper, then we go to the fasting insulin level to exclude the PCOS, all these things. Then what else? Ultrasound must be transvaginal. It is most uh, better, more better than abdominal. Then hysteroscopy, we directly see the uterus through the vagina, cervix, and then last to check the tubes and uterus, we hysterosalpingography. We give some fluid from vagina and take the pictures of the tubes, X-rays. We see that whether it is spilled, it is coming out from the tubes or not. Finally, because endometriosis or any scarring, it is difficult to diagnose and the ultrasound or other things. So we'd go for the laparoscopy. If all these things we don't find anything, then we go for the laparoscopy, which causes are preventable, or we can modify those. Life is changing because stress also, we have to manage of the stress and healthy weight. If one woman is very obese or very thin, poor nutrition, we should manage it. If she's smoking, taking alcohol, history, we should change those things. If she has chronic illnesses like diabetes mellitus, asthma, and other things, we should manage those and control them, hypertension in all disease. Then we give the medications. Medications, if there is all the things are, the reproductive system, the tubes are open, the uterus has got no anomaly, no fibroid, no structural problem, vagina, then we can stimulate ovulation. We give the clomiphene, letrozole, which stimulates the hormone and releases egg, and then further it is taken procedures. If someone, we see that there are fibroids which are hindering this implantation, we remove that. If there are polyps and there is scar tissue, then we do. Unblocking fallopian tubes is little bit difficult, but now at the advancement, they are doing this, these things. Then if we see, we ask the woman that track ovulation, basal body temperature. Nowadays, it's very easy because the kits are available where the patient in early morning before uh, uh, waking up, just waking before is taking up out of bed, she takes out, takes temperature. If it is 99, it means ovulation kit will show that and then on that day, we ask the females that now your egg mature, you can go for intercourse, because there is only one day where in this fertilization. Then cervical mucus for fertility signs. Mucus should not be hostile, it should be thin and facilitate it. The female is told that you can check this mucus consistency. So we need a complete